Senator Mitch McConnell from Kentucky, he's 81 years old and he's making headlines right now because he's had two episodes over the last 2 months where he freezes up, if you will, for about 30 seconds. And so when I think of what's going on here, he's an 81-year-old guy with a history of polio as a child. He's had multiple falls where one of these times during his falls, he hit his head and had a concussion. And that wasn't all that long ago. So when I think of medically what's going on when someone freezes up for about 30 seconds, and it's happening at least twice that we know of anyway, where it's been caught on camera during public speaking, there's really two things that come to mind that are at the top of the list. Now, there's more than two things that can cause that, but the top two things that come to my mind are one, a partial type of seizure, particularly what's called an absence seizure or an absence seizure, meaning the patient just looks like, or the person just looks like they're not all there, where they just have this blank stare on their face. And these episodes last for about 30 seconds or so. And that's why I think that's a highly on the differential diagnosis. The other thing that it could be would be something called a TIA, which is an acronym for transient ischemic attack. And that's basically a fancy way of saying that part of the brain has a temporary cessation of blood flow. And when that becomes more permanent, meaning there's more of a permanent blockage there, that's actually called a stroke. So a TIA is basically a mild version or temporary version of a stroke, if you will. That's why TIAs are often referred to as mini strokes. So those are the top two things that come to my mind. Now, when someone has an insult or an injury to their brain from a trauma, for example, when you fall and hit your head, that can make the brain more susceptible to having seizures. Also, when someone has underlying pathology besides trauma to the brain, so for example, if someone has a history of a stroke where part of that brain is actually died off, that part of the brain can be more prone to having seizures. Other things could be going on as well that make the brain more prone to having seizures. It could be, for example, a tumor of the brain could even present that way. Although I doubt that's the case with him because I'm sure, or pretty sure by now, he's had at least a CAT scan of the head and most likely an MRI of the brain to evaluate the underlying brain structure. So I do think that's less likely. Now, his attending physician at the White House or at the Capitol has come out and said, well, this is most likely related to lightheadedness and dehydration, which I disagree strongly with because that's not how dehydration presents. Dehydration can present with someone passing out. They could feel lightheaded and pass out. But normally with dehydration, someone isn't just talking normally and then all of a sudden they freeze up with this rigid arm or rigid arms and they have this blank stare on his face. That's not part of dehydration. Lightheadedness is a symptom. It's not a diagnosis as to what's going on. So he could be experiencing lightheadedness as a symptom, but the symptom itself is not what's driving the cause of what's going on with him. It's not driving his diagnosis. It's a diagnosis is driving lightheadedness as a symptom. So I disagree. I think it's actually inappropriate to label this just being simply attributed to dehydration and lightheadedness. There's always something that's driving the underlying cause, and it is oftentimes hard to figure out what is the underlying cause of what's going on. Like I said, seizures can be driven by something that's underlying. Even a stroke can be driven by something that's underlying. So lightheadedness is a symptom. Dehydration, it's more complicated than that. Dehydration just doesn't simply present like this clinically. So, those are my top two differential diagnoses. Other things in the differential could include something like Parkinsonian type diagnoses where you have, it's basically like Parkinsonian or Parkinson's disease, but there's different diseases that have variations of Parkinson's disease. And there's multiple diseases that fit into that category, at least three that come to mind off the top of my head. But again, I think that's lower on the differential diagnoses. Sometimes medications can present oddly like this, or medication side effects can present oddly like this. But I do think that the two most likely are partial seizures, which could be in the form of an absence seizure, but also TIA, transient ischemic attack, or a mini stroke. We'll see, how this all plays out. When someone's 81 years old and they have multiple falls and they have these types of issues, whatever's going on with him, whether it's seizures or TIA or whatever, especially as they occur over and over, it does become very, very concerning. And, we'll just have to see, how this all plays out with him. And I know that, he's, downplaying what's going on or minimizing, what's going on, saying he's fine, he's fine. But as a physician, I would be very, very concerned with what's going on with him.